right, welcome to DC Revolution, helping chiropractic students think big in order to live large. I'm your host, Knowles, and today I'm here with Dr. Adam J. Swick. He's a chiropractor at Velo Sport Rehab in Washington State. After graduating from University of Bridgeport College of Chiropractic in Connecticut, he combined his passion for rugby and sports chiropractic by going to Sydney, Australia, and practicing chiropractic there. Now he's back in the States, utilizing the latest research to guide his clinical approach, using gentle chiropractic adjustments, soft tissue, nutrition, therapeutic exercise. So, Dr. Swick, thanks so much for being here.
Thank you for having me.
Yeah, my pleasure. So let's jump into your story a little bit here. Can you tell the audience why you went to Australia, how long you were there, and what, why did you come back?
So immediately after graduation from University of Bridgeport, I knew I wasn't looking to try to set roots in the United States necessarily right out the gate. My partner was finishing up her master's studies overseas, and it seemed like a really great opportunity for both of us to spend a year in travel, and then also learning more about ourselves and kind of where we want to set up. Eventually, that decision kind of started to filter down into, where can I practice my profession internationally, and what country has the best opportunity, relatively speaking, for quality of life and practice. Looking at those items, especially for our interest within sports, travel, culture, New Zealand and Australia became pretty high up on the list very quickly. Speaking with a few of the mentors that I had over at University of Bridgeport, Australia moved up quickly on that list as far as where am I most likely to succeed, where am I most likely to kind of find myself in practice, and then also personally. So making that decision was a big leap, and that was a very calculated decision that probably started around year 2 of the 4-year program over at the University of Bridgeport. Ultimately, the jump to actually make that decision and to sit for the boards in Australia happened while we were traveling a few months after graduation. And so putting all of that into action and preparing for not only the board's requirements to practice there, but then also identifying practices that fit personality-wise and with my beliefs as far as what quality patient-centered care is. It was much more of an endeavor than what I ever could have imagined. Fast forward, I end up sitting for the boards in Western Australia, pass, get licensed, and then it's that aspect of first year of practice. Now what? So ended up getting connected with a multidisciplinary group in the heart of Sydney and practiced there for only 6 months. So a pretty brief amount of time before the realities of being in Australia, pretty reserved from friends and family, really started to hit home. So making that decision as far as what is the work-life balance that we're trying to establish, Australia, while a lot of fun and a really amazing experience, became a reality or an understanding that that wasn't going to be home long term. So that first year was spent in preparation, finding a practice, getting into practice, establishing. And while that experience itself took almost a year in total, the lessons that I learned as far as how to manage patients, what practice style I would like to be involved with, working with other providers within the healthcare system, was invaluable. relocate back to the United States and kind of pick up almost the same process again. So that decision making of where do I most likely want to be? Where do I most likely want to establish myself? So I'm not looking to relocate again, go through the process of building a practice again. And that quickly became Washington State, and then specifically the Seattle metro area. Just by chance, that associate position that I ended up taking in what is Bellevue, Washington, segued into the opportunity of working with one of the hospital systems on standardizing their integrated care pattern for spine care, specifically low back pain algorithm, for how to utilize chiropractors within a hospital system.
Yeah, I really want to dig into that because that's something that I'm very curious about. I've talked to Dr. Lehman over at University of Bridgeport. You know, he's done a lot of work along those lines. But first, I interviewed another Australian chiropractor, and he really laid out all the steps that you went through. And you did say it took you a year to get your license in Australia, but it's a process, you know, like you went through a lot, at least from what I've learned, in order to get your license there. And of course there was a silver lining at the end, you know, and you really got what you wanted out of that experience. What would you recommend to students who want to practice internationally? Do you feel like it's kind of a long-term investment, or do you feel like you could feasibly practice somewhere for a year, 2 years, and it's worth the investment of time and energy?
So I can speak to my personal experience looking at what practice life is in Australia. Since I only wanted to practice within an area where I could see myself establishing a place relatively long-term. So that balance of I want to invest fully and kind of commit to the experience, but also recognizing that there are certain places where I'm not really interested in practicing. Specifically countries that chiropractic is not recognized as a licensed protected profession. So for the board exams that I sat, I believe there were 12 or 14 of us who went through the initial testing process. And I believe two or three individuals passed on their first attempt. So the testing process specifically for Australia, specifically at the time that I took the exam, was pretty rigorous. And there were individuals from South Africa, England, a variety of schools within the United States. And there's only a handful of us who actually ended up passing on the first attempt. Recognizing that, the advice that I would give somebody who's looking to practice abroad, especially if they're directly out of school, they have to have a level of uncertainty and being comfortable with really high risk. And there are just so many possible stumbling blocks or obstacles that if you are the type of personality that is more risk adverse or more afraid of that insecurity, it's going to be very difficult. But if you feel comfortable putting yourself out there, introducing yourself to literally every contact that you can, over preparing so that you can guarantee that you set yourself up for success, it's an amazing experience.
Yeah, that's perfect. I really appreciate that insight into, you know, it's possible for anybody, and yet you have to know yourself well enough to know whether it's what you want to go through and what you want to do. So let's jump into, you know, what you mentioned earlier about this multidisciplinary practice environment within a hospital. Can you talk a little bit about how you got that opportunity, what the opportunity looked like, and maybe guide, you know, students who may want to kind of go in that general direction on what skills they would want to cultivate now?
So there's a few questions there. I'll do my best to kind of filter out each one. How I got there, and then what it's like, and recommendations for somebody who's looking to do something similar.
Correct.
Right?
Yeah, that'd be great.
So and are you speaking in Australia or coming back to the States?
I would say coming back to the States, working in the hospital environment up in Bellevue.
So to be clear, the organization that I was a part of is a private practice that is integrated within the referral system for the hospital system in Bellevue, Washington. And so to that end, the how I got connected, I was just by dumb luck able to get on the coattails of an individual who has established a really well-known practice for the past 30 years, I believe, in the area, and has some really positive and meaningful connections with the medical providers in the area. Initially, my understanding when the project first began, it started with 13 clinics in the surrounding area of the hospital. And those clinics were largely selected based on who the physiatrists were referring to for conservative musculoskeletal care initially. They had worked with them, they had established relationships, they appreciated the work that they did. And when that private practice physiatry group was absorbed by a hospital group, said, well, we have the means and the bandwidth to establish a larger program. Let's do this. So that was the early days of the program. I believe that was about 4 years ago. And I got connected with the program approximately 3 years ago. What does that look like? So for individuals within the hospital system that are presenting with a spinal complaint, if they are triaged and deemed that they are not in a progressive neurological deficit, or they don't have red flags urgent enough to warrant a direct surgical consult, they are either tiered into chiropractic, physical therapy, or physiatry, depending on their symptomatology. From there, that patient is then connected either within the hospital or either to the private practices in the area for what the patient wants, and then also what is most indicated based on how they're presented. From there, I mean, it's really straightforward evidence-based care. Individuals should be responding within a short trial of care. If they're not, you either need to assess what you're utilizing as an intervention, or that individual needs to be transitioned to another provider that can provide the services that they're looking for and that are most indicated for how they're presented. If you are doing well by the patients, if they're improving, then you just continue to monitor objectively and subjectively how their progress is. And when it's done in that stepwise fashion, it's really straightforward, and patients are highly satisfied, and providers, specifically the physiatry group, are ecstatic because you're a problem solver for that kind of difficult presentation of undifferentiated axial back pain. Recommendations for individuals who are looking to get involved in a similar setup, or individuals that are trying to possibly arrange something themselves. Meet as many individuals within the medical community as you can. One of the most natural and kind of organic environments for that are grand rounds. For every teaching hospital that I've been near, grand rounds are open. And so you can attend and provide feedback, meet other like-minded individuals in the area. And long before you'll receive a referral or get networked with an individual, they have to know you, they have to like you, they have to trust you. And then based on that and your ability to help them with their patients, that is the fertile ground that can create this interdisciplinary model of spine care.
Cool. Thank you. I think that was really, it was definitely valuable for me, and I know valuable for a lot of other people. And I just wanted to clarify to make sure I'm understanding the system right. I mean,
Please.
the clinic that you work at is basically a referral source for the hospital. So you're not an employee of the hospital, or you're not like directly related to the hospital outside of being a place that you refer back and forth. Is that correct?
That's exactly correct. So
Okay.
the pilot program that was initiated 4 years ago has expanded to the greater Seattle area. My understanding is that there are about 70 plus chiropractors that are involved across 40 clinics.
I guess what I was asking you about is the pilot program, and whether the pilot program has a name, and if there was a way for enterprising individuals in other areas to kind of use that as an example of this working and try and implement a similar program in their local communities.
Great question. The Swedish Chiropractic Pilot Program for Swedish Hospital is the name of the organization. The pathway that has been standardized across PT, chiro, physiatry, surgery, and then what's considered their restoration or functional restoration program is all proprietary for Swedish Hospital. So unfortunately, that's not information that I can share at this point in time because it's property of the hospital itself. The transition away from that, I am available to speak to or have a conversation about what the organization looks like, relevant research that has been helpful in opening doors and kind of getting a place at the table as far as spine care and what that means being a chiropractor who historically hasn't had a place at the table within the hospital system. And easiest way of getting in contact with me is via email, drswick at VELOSPORTSREHAB, velosportsrehab.com. Happy to field any questions from any individual who would like to know more about the program that we're currently doing, or how they can start to replicate some of the steps that were required 4 years ago to even get the program off the ground. Circling back to kind of what I would recommend for an individual who's looking to create a similar project or to open those doors into a hospital system, it is phenomenally easier, and I would even argue only viable, if you have a champion from within who's really pushing the program. So as an outsider knocking on the door, it is very unlikely that you will be able to initiate a program of this scale for such a complex program in a hospital system, unless you have somebody within that's really looking to expand and try a new way and a new means of improving their spine care. For our group, that was the director of musculoskeletal medicine at Swedish Hospital. And previously for Dr. Lehman, who was one of the mentors I had at the University of Bridgeport, he had a mutual patient possibly, or a connection within the hospital system that really was the facilitator to champion him as a provider to make it all possible.
Yeah, thank you. And something you mentioned pre-roll that I just wanted to clarify or outline was, are you a volunteer then? Like you mentioned that you were volunteering in some capacity, and I wasn't entirely clear on what capacity that was. Could you clarify that as well?
Happy to. So a lot of the initiative and organization for what it takes to get the program off the ground has been done to create the program itself, and that has been unpaid service. So the research that has gone into citing the different steps of the pathway, the indications for when referral should happen, what a minimally clinically important difference looks like within spine care. All of those items and all of the information that went into drafting that was uncompensated. It is to the end that it's expected ultimately that will create more of a referral pathway and more patients coming into our office. But up until this point, everybody involved with the pilot pathway has been uncompensated for their services in trying to build this project within the hospital.
Got it. And then one last thing I wanted to ask you before we close today is, I mean, to me, this sounds really exciting because I feel like you're, in a way, the work that you're doing with Swedish Hospital is somewhat groundbreaking. I know Dr. Lehman's work is also along these same lines of really figuring out where chiropractic's place is in the whole spectrum of different practitioners and what things we're really good at. When I talked to Dr. Ann Jensen, who does a lot of research, she was at Oxford for a while. She said it's, so many people are focused on does chiropractic work, but what she really wants to know is if chiropractic works, what does it work for and how well does it work for those things? And I feel like you're answering a lot of those questions. Do you feel that way as well, that you're kind of doing something pioneering in terms of the work that you've been doing with Swedish Hospital?
To my knowledge, this is the only hospital system of this size utilizing a standardized pathway happening within the United States. I cannot conclusively say that because I'm not sure of every hospital system across the United States, but it's the only one that I'm aware of. So to that end, it is exciting and it is pioneering in the sense that we are attempting to do something, bringing in over 40 different clinics with different systems, with different providers, and saying, okay, this is what we agree to. These are the expectations of being a part of this program. And there has been attrition for practices that didn't want to follow the standardization and the rules. There is a lot of interesting research looking at who will respond specifically to manipulation, who will respond more towards a stabilization exercise program, individuals more likely to respond to a psychosocial intervention. And within the spine care pathway at Swedish Hospital, chiropractors, if we can take that opportunity, are very well suited to be able to delineate and stratify those patients to get them great results. One of the really humbling aspects that I've experienced in practice and then also in conversation with other providers, spine care isn't easy. It is confusing. There's a high level of uncertainty with pretty much every patient that you interact with on a daily basis. And people experience that as well. So their suffering, their fear, what they're experiencing as a patient, they have a million different thoughts, a million different anecdotes coming at them for what they should be doing, be it ice, be it heat, be it painkillers, be it anti-inflammatories, massage, chiropractic, acupuncture. So being that expert within spine care to dictate who is going to be best served by what provider is a really, really challenging position. But if we can own that as a problem solver of spine care, we can not only establish ourselves in a much higher level of cultural authority at large, but position ourselves as a highly necessary aspect of hospital systems across the United States.
Yeah, and that's powerful. And I can't imagine any chiropractor who doesn't, want that to some extent. I mean, we are trained to be doctors. We're trained to make those hard decisions about what type of care is going to be best for people. And like you stated, as a gateway to kind of help direct care, that is extremely exciting. So I know you already mentioned your email, the Dr. Swick at velosportsrehab.com. I'll put that in the show notes for people. Is, besides email, is there another avenue for people to learn about you, learn about what you're doing, learn about the research that's available in terms of our place in the whole spectrum of healthcare? Any references you would recommend to students at this point?
Yep. So the suggested reading list for the World Federation of Chiropractic is a fantastic literature-based or literature resource on where we are, the evidence that we have to support what we're currently doing, and then the emerging evidence for where we'd like to go. So that would be the best research as far as moving forward. As I said before, the Swedish Hospital Pilot Program algorithm and their pilot is proprietary to the hospital, so unfortunately I can't provide much information on that. For individuals who would like to get in contact with me, Dr. Swick at velosportsrehab.com is the easiest means. Our website, velosportsrehab.com, will have some brief information about kind of what we do, how we do it. Otherwise, if I can be a facilitator or liaison for anybody who's looking to try to get a similar project off the ground, I would love to have that opportunity. So James Lehman was instrumental in creating the CHC program in Connecticut. I had the opportunity to rotate through while I was a student at University of Bridgeport. And that kind of gave me the courage, but also the optimism that chiropractors don't have to operate within their silo. So we can be a very valuable member within a spine care team if we step up to the plate and we start utilizing the phenomenal education that we receive to its highest level.
Awesome. Yeah, really appreciate that. So the great information. I hope that inspires a lot of chiropractic students to really work towards this opportunity that's being presented with all the work that you're doing. This is really exciting. So if you like this video, please let us know. Subscribe to the DC2B Revolution, where I'm helping chiropractic students think big in order to live large. Share this video, get the word out there about the potential and the possibilities that are being opened up. And yeah, thank you, Dr. Swick, for your generosity, for your time, for your information. Really appreciate you coming on today.
Of course, my pleasure.
All right.